Broadcasted live for the world to see. Our patient is here having 2 discs in his lower back fixed for herniations that are causing back pain, and we're going to be fixing one other disc higher up in the upper back, really at L1, L2. So we have an L1, L2 herniation that's causing problems, and we have an L34, L45 disc herniation causing problems. And they're in separate areas of his back, and they both need to be, or all 3 need to be addressed. So that's what we'll do today. All right, Dr. Duke here. Are you comfy? Perfect. It's important that you lay still for me, okay? And I'm going to give you some numbing medicine. That's going to sting a little bit when it goes in, but then I'll just keep giving you numbing medicine to keep you comfortable, okay? If you have pain, say ouch. And then I want to hear from you, is the ouch in your back or down your leg, like a shot down your leg? I don't expect anything down your leg. You might have a little back pain. But just say ouch back or ouch leg, okay? All right, but don't move your body around. Lay still. Okay, you're going to feel my hand pushing. I'm just palpating. So we're going right side, 3, 4, 4, 5. All right, you're going to feel a little stick and burn, okay? That's just a little numbing medicine going in. I apologize. This is the part that whatever you can do to get him comfortable and relaxed. And then I need him awake and about, really, not asleep, obviously, but just more comfortable. Yeah, he's doing great. You're doing really good. So, obviously anxiety has an effect on perception of pain, right? And so some people are more anxious than others. Okay, so that's 3, 4. I'm going to give you a little pinch up here. I apologize. I know it's uncomfortable for you. But we're just giving you that numbing medicine. It's going to feel better shortly. Okay? Yeah, I know. I know it doesn't feel so good. Okay. Good. Just about done. Okay. 8 cc's injected of local. All right. Are you comfortable, sir? All right. As comfortable as you can be for having a surgery, right? Everything's going well. Don't worry. Everything is fine. I'll let you know if we have any problems, okay? Shot. So our first disc is going to be L12. And we're going to need to be a little bit higher. Let's see where T12 is. There's 12, there's L1, and there's L2. So a little bit higher than where we are. Another CC injected, watch that. Shot. All right, let's get a lateral, please. He's got beautiful spinal anatomy. At the bottom, there's a little bit. That was the fireworks going off in the operating room. I'm kidding. That was our pressure bag. That's fine. Yeah, we're good. Let's shot. Of course not. All right, let's zoom out a little bit. Shot. Okay, I need to see the sacrum. I need a metal. Sacrum, shot. It's way too far south. I need the table up or the fluoro down. Which one do you want to do? Okay, good. Now, shot. All right, sacrum, 5, 4, 3, 2. Shot. Shot. 5, 4, 3, 2, 2, 3. So it's 1, 2. Should be a little bit above that. All right. Let's do this. Let's go north a little bit. and shot. So that's 4-5. I need to see the iliac crest. Come down a little bit. I think that's 4-5 right there. Shot. That's probably 4-5. So that would be 4, 3, 2, 1. So 1, 2 is up there at the top. We need to drop the table or raise the floor a little bit. About 1/2 inch. And shot again. So 4-5 is 4, 3, 2, 1. 1, 2. Shot. I apologize, I know that's a little uncomfortable. Shot. Why am I not seeing it? Can you... no, I don't want to do anything just yet. Let's give some numbing medicine. Let's get rid of that. I need another one. Another stylet, yeah. I just gave you some more numbing medicine. Where's the other one I just gave back? Off the table, off on the floor. No, don't try to grab it.
Can I have another spinal needle, please?
I don't need another spinal needle. We're just going to reuse the stylet.
Not a problem.
There you go. That's being smart. 4, 5. 4, 3, 2, 1. 1, 2. That should be 1, 2 right there. Shot. Shot. Should be the 1, 2 facet. All right, now let's go down again, or let's bring the table up a little bit, like 1/2 inch. Fluoro south. That's too much. This is like a 1/2 inch movement. Come on, man. Shot. Dude, you got to stop moving so much. Shot. All right, 4, 5. So 4, 3, 2, 1. It looks like 1, 2. All right, so the bubbly gas on the bone is probably going to be 5, 4, 3, L3. Go north a little bit. Slow a little bit and a shot. That's 3 more north. Let's go 1 inch. And shot. All right, that's 3, that's 2, so that's 1, 2. You agree?
I agree.
We need to change the orbit. We're totally off on the orbit there. Shot. I can't tell if that's better or worse. It may be the other way. Shot. I think that's better. Now you got to change your wag. Look at the pedicles of 1 up there. Just a little bit, about a degree. Can't really tell if that's better or worse. Do another degree. Shot. That's weird. It's got to be the orbit. Your orbit is off. Bring your side down, please. Again, more. Further down. Get it level. Shot. That's definitely better. That's definitely better. A little more. Let's see if we can make it even better. Shot. That's too much. Go back. Shot. All right. So what we're doing is we're getting the x-ray images to be perfect. Are you comfortable? Yeah? Good. That's the response I like. Shot. All right. Shot. I think we need to be a little more lateral. Shot. 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 That's lined up nicely. Shot. Are you comfy? Shot. I think I have just a little too much facet. I'm going to come a little bit more. Shot. That's close. Shot. We're just hitting that superior facet of L2. Shot. Let's get an AP and then come back to that same lateral. Interesting. He's got a little rotation at this level. Yeah, back to a lateral. So we're looking pretty good. We just need to be a little more lateral than we are. Just relax. You're doing great. Shot. 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 You comfortable? Shot. 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 The shot I'm talking about, folks, is the picture. Okay. Shot. Shot. I like our trajectory. Are you okay? So I need to be just a little bit more lateral. Shot. 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 You comfy? Okay. So give me an AP. We're in the framing. Let's see. 5, 4, 3, 2, 1. So definitely counting bottom up. We're good on the localization. So it's 1, 2, skip 2, 3, 3, 4, 4, 5. That's perfect. So let's go back to a lateral view and just count from bottom up one more time just to be sure. We want to make sure we're treating the right level. And the way you figure out the right level, folks, is using the x-ray machine. You count the bones. They're called the vertebral bodies. Of course, there's more than just a vertebral body. There's pedicles and lamina and spinous process. But the vertebral body is how we do everything. Yep. So I need to see 5, 4, 3, 2, 1. Let's go down and make sure that's 5. Just a little bit. And shot. So there's the sacrum, most likely. Just keep it on cine and start a little bit. Go another ½ inch south. And now hit cine, keep it on, and let's just move up a little bit slowly. Shot. Good, and move up. 5, 4, 3, keep going. 2, 1. Stop, and that's it. Shot. So we're right at 1, 2. Everybody in agreement? Thank you. All right. Are you comfy? Just relax. I know this is going to be the worst part of the surgery for you. Where do you feel that? Back? Yes? Doctor, I need you to help me. Back?
Yes.
Not down the leg.
No.
Shot. I need better visualization of that, Jordan. Yeah, you're fine. We're right where your bad disc is. That's why it hurts you. So I'm running against the top. Shot. Shot. All right, so there's our first disc. You did great. I apologize. Are you okay? You want to take a moment, just get a deep breath? All right, let's come south. You're doing fantastic. All right, everything is going really good. So we're going to be able to put you to sleep soon, but just not yet, okay? Does that hurt? Yes? Let's get some more local. I apologize. Going to give you some more numbing medicine, okay? All right. Any questions from our audience? So our patient is here at Duke Spine Institute because he's been having back pain. How many years have you had back pain for? 13 years? 14 years. And I need to see, yeah. So there it is, 5, 4, 3, 3, 4. So 14 years, how come no one's fixed your back? Oh, our blood pressure should be around the same, 110. It's fine at 116, but if you can get it down just a little bit, it's perfect. Why didn't anyone fix your back? Huh? What did he say? You saw 4 surgeons in Canada. Canada, right? Yeah. And did they want to do surgery? No? Shot? They want to cut you open and fuse you. All right. That's what I needed to know. And you didn't want a fusion, obviously. Shot? I don't blame you. AP? I need you to... There's like a little fuzz from my mask on my right nostril. Just go in there with your finger on the side and see if you can grab it out. No, right nostril, which is underneath.
Oh, underneath?
Like you're touching here, it's here.
Got it. Okay.
Yeah. Uh-huh. Yeah. Something in there. It's good, yeah.
Okay.
Thank you. It's bugging the heck out of me. Whew. All right, so we're a little lateral on the AP view, anterior posterior view. Yep. Let's go. We need that shot. All right, yeah, we're fine. This is a good trajectory. Where do you feel that? Back? All right, don't move. You're doing fine. Shot? Can you try to keep them a little bit comfortable? I can't really give him too much local here because we're so close to the root. And I don't want to numb up his nerve root. Shot? Shot? You're fine. Everything's okay. Just don't move. Shot? You're doing great. Let me know if you feel anything. Shot? In your back? Okay. Yeah. Magic. It's just magical what this does. It's incredible. All right, well, is that better? All right. I apologize. I know this is the worst part of the whole surgery for you. It is for me too, trust me. If I didn't need you awake, I wouldn't keep you awake, but I do need your help. What's that? Mm-hmm. This will be the last one. Now, I've done many fusions in my career. Many. And this is 1,000 times better surgery for you. Shot. I think I want to make this a little bigger. He's got very thick skin. Are you comfy? All right, good. We did our little 7mm incision, your Band-Aid incision. That's it. That's all we're going to need. Let's give him a little more numbing medicine. Shot. So it looks like we need to do something there. You see that, Jordan? On the, I think it's the orbit. That was some numbing medicine I just gave you. Just give it a minute to work, okay? Shot. Shot. Everything's going really good back here. Shot. Let's get an one more shot. Hold on, let me just see. Shot. And give me an AP. Well, you can look on the X-ray. You can see at L45 the disc bulging out. You see that? You see it, right? The shadow. It's pretty impressive. Can you do my tape a little bit up here? Getting a little fog. Yeah. Thank you. Huh? The air? Oh, no, not yet. Yeah, in a minute, but not yet. All right, so let's just see for a moment. I'm there. Let's go back to a lateral. We're probably a centimeter away from the disc. Yeah. Huh? I didn't. In Canada? Don't worry, we're going to fix your back, man. You're going to do great. You're going to do great. Just, I need you awake for one or two more minutes, and then actually 5 more minutes and we'll be done, okay? And we'll get you to sleep. Shot. Yeah, I know. That's why we're here, to help you. Because I know what it's like to live in pain and have nobody be able to help you. It's just the worst thing in the world. Are you comfy? Yeah? So look at that. I'm actually touching the herniation. Can you see the bulge? Why don't you put the arrow where you can actually see the shadow of the herniated disc? Yeah, it's right in there. And I'm touching up against it at L45. I literally feel it. I can feel it. Feel it. Go ahead and feel it. It's pretty cool. Just gently push in. Use this. You can feel the resistance that you get, like a rubber. A little rubbery. Yeah. All right. Yep. So there we go. That's a big tear. I can feel a big tear. All right. So this is a 3-level fusion normally. And this is the blood we're going to lose for the whole surgery right here. Probably 5 mils of blood. That's it. Done. Are you comfy? No pain? Watch it here. Watch it here. Gosh, I'm fogging up now. So, we need the marking pen. You're going to watch this video, and it's going to be pretty cool because you're going to get to see everything we did, okay? Now, I'm just going to talk for a minute, all right? So, you got these bones in your back, and your bones are fine. There's nothing wrong with your bones. But between these bones are discs or cushions. And the discs have been damaged in your lifetime. You did something to damage them. I don't know what it was. It's not that important because it's probably some trauma that happened in your lifetime, okay? And this is the number 3 bone, the number 4 bone, the number 5 bone. And up here we have the number 1 and 2 Okay, number 1 and number 2. 2, 1. And then you got a disc here. So we're actually going to test these guys, and we're going to figure out which ones are causing pain. Are you comfortable? How bad is that on a scale of 1 to 10? 10? Is that your typical pain? Is that where you typically get it? Yeah? All right, so is it 10 out of 10 at 4.5? Yeah. All right, I apologize. Have you ever seen an evocative discogram done? Now you have. People say these things don't work. I mean, not the only people saying they don't work are the people who don't want to pay for them, like insurance companies. How bad was that on a scale of 1 to 10? All right, that's the 2 discs we're going to fix. They're both 10s, and you can actually see up there the dye has leaked out through a tear. You see the tear in the back of the disc, and it's leaked out around the nerve root. So that's 2 10s out of 10. As soon as I do this third one, we can put them to sleep with propofol. All right, are you better? How bad is that on a scale of 1 to 10? Another 10, wow. And is that where you get that typical pain higher up? All right, we found you 3 bad discs, and we're going to have those 3 fixed by the time you wake up, and that pain will be gone the rest of your life. Just don't re-injure your back. Okay, so amazing. And I'm having trouble with the fog. Now, I want you to count from 1 to 100 out loud so we can hear you loud and proud. All right? And count in Canadian for me. Yeah, I'm getting a fog up. Yeah. It's better. It's just kind of warm in here, though, don't you think? You feel
I
it?
think it's a little humid.
Maybe you can see if you can open this, and then it lets the air vent out through the sides. Yeah, if you can just kind of. Almost like I tied the lower strap. There you go. That's probably good. Yeah. Let's try that. Nice and loud. If you get to 100, we don't pay the anesthesiologist today. All right. You're doing good. Keep going. So right now we're going to do the L12 disc. Go ahead and move your fluoro and center it at 1-2. So it's unusual to get a herniated disc at L12, and then it's also unusual to have pain from it when you do get it. Just biomechanically, it's unusual. So, but he's definitely got a painful disc at L12. We confirmed that on discogram, and I suspected it based on his examination when I examined him. And he's from Canada. You know, unfortunately, the Canadians don't have a lot of access to Duke Spine up in Canada unless they fly to Orlando, which he did. And we get a lot of Canadian patients. We have almost 1 a week now that we average. And they come here because of what we do is not found anywhere in Canada, and it's not found anywhere in the United States actually either. And they always come here and say, you Americans are so lucky, you guys have such great health care. But it's like, well, actually not really, just here. This technique is not available anywhere else in America, unfortunately. So, all right, I'm feeling a little resistance. I'm going to pull the needle back and leave the guide wire. That's my intention. And we're going to pull the needle back and leave the guide wire. I don't want the guide wire going further in, and I certainly don't want it coming out. There you can see the needle is moved. And I'm just going to do this slow, and see the tip of the needle is at the back of the facet joint. Now we've got our needle is gone. We've done our discogram. We were 10 out of 10, by the way, in all 3 discs, okay? Needle up here. We're going to make our incision. Now, if you pay close attention, if you're a regular customer here on our show, you'll see that for 3-4, my incision is more lateral, and that is correct. For 5-1, it's about the same spot. What I mean by lateral is if you drew a line this way, okay? It's right where the skin starts to tilt over. However, at 1-2, it's not so far lateral. And you got to be careful up here because the kidney's up here. You don't want to damage the kidney, okay? Obviously, don't do this surgery unless you've been trained to do it. but those of you thinking about it have to be super careful you don't get in trouble injuring anything inside. Okay? So you don't want to start too far lateral at the higher levels lumbar, and thoracic, same thing. You want to be more medial. This is a 7 millimeter incision. In 7 millimeters, we're going to do the entire surgery through a metal tube called a tubular retractor. Okay? But I'm going to first pass this dilator down over the guide wire. I can feel it passing through the fascia. Fascia is the covering over the muscle. And you've done a very nice job, doctor, because he's not responding. So thank you. Now we're right at the back of the disc. You can see the tip of the dilator is at the back of the disc. So the tip of the dilator is in the foramen, and I am literally pushing on the herniation right now with the tip. I can feel it. It's got a little spring to it. Okay? So now we're at the tear, the annular tear and the herniation. I want to pass through it and into the disc itself. So I'm going to use a little mallet. And people always wonder, why do you use the mallet? Well, it looks so, brutal. Doesn't look elegant. But the mallet is really a very good way to deliver energy in a controlled fashion. Okay? The last thing in the world we want to do is shove and push on this pointed metal stick, and then it goes in places we don't want it to go. Okay? That would be catastrophic. Because just in front of the spine is all the intestines and the blood vessels that feed the legs and the pelvis. And if I go in too deep, I could damage something in there. So you want to deliver just an exact amount of energy to the dilator to get it to go where you want it to go. Now, the tip of this dilator spreads the tissues apart. I got it. I want to look at it and feel it. Shot. So the tip of the dilator spreads the tissues apart. It doesn't actually cut any tissue. It just spreads it. And when we're done, we're going to pull it out, and the tissues will collapse back. So there's no permanent damage to any of the tissue. There's no scarring either. Okay? I think we're okay. So there you have it. And we're going to do the entire surgery through this little cut, and this patient's going to get a Band-Aid. He'll go home in an hour from now. Okay? So this is my suction tube. I'm going to connect. Once again, you're watching a very unique surgery. This is the most advanced spine surgery in the world, and it's called the Duke Laser Disc Repair. It was created and pioneered here at Duke Spine. It is all FDA approved, 100%, and it's been peer-reviewed and published outcomes. So the outcomes of this surgery have been studied through a research process and statistical analysis, and the outcomes are safe and effective for the treatment of herniated discs, back pain, neck pain, arm symptoms, leg symptoms, radiculopathy. So herniated discs or degenerated discs. Okay, let's get the scope on, please.
Stand by light. Stand by light.
Oh, Zane. Zane is still gone, huh?
And stand by. Perfect.
Okay. All right, we are inside the L12 disc through the left approach. We know this disc is a 10 out of 10 pain, and the blue stuff is the herniation. So my job is to get rid of as much of the herniated, degenerated nucleus pulposus as I can safely.
Lights off, please.
All right, we're ready for the laser.
Jeremy, you ready?
So people ask me, why do you need the laser? Well, I've just taken out everything I can without the laser. So everything we do from now on is with the use of the laser. Traditional surgical instruments don't work for this. So the laser fiber is that little glass thing at 12 o'clock. And it's literally 0.5 millimeter wide. That gives you an idea of how zoomed in we are and how much we've blown up the picture, because that little glass tube is 0.5 millimeter. Most people can only see 1 millimeter between their fingers of light. This is 0.5 millimeter. So think about how small it is. It's extremely precise. The width of this tube from side to side is about 6 millimeters from inside to inside. On the outside to outside, it's 7 millimeters. So that's why our incision is 7 millimeters. Wipe. Thank you. The incision is 7 millimeters because we only need a 7 millimeter incision to get this tube in. As a matter of fact, we can do 2 discs with 1 incision, which we're going to show you in just a minute. We had to make a separate incision up here on the left side because the other 2 discs we're fixing on the right side, because that's where most of his pain is on the right down there at L34 and L45. Again, this surgery will replace fusions and artificial discs, laminectomy, and microdiscectomy. There is no need for those open, destructive, damaging surgeries anymore. We now have this technology. We've been using this surgery now for 16 years. And we've never had a single complication. Our patients enjoy immediate elimination and relief of their back pain right after surgery. And we've had 0 complications to date. What am I zapping away? I'm zapping away the herniation, and I'm zapping away the scar tissue and the inflammatory tissue inside the annulus fibrosus. You can see it. It's right in here. How do I know what to zap? I've been doing this for a long time. Look at the, just behind the laser there on the metal surface are little areas where the laser hit the metal and melted it. That's melted steel from this laser. Each one of those little circles is a blast, one little blast from the laser, literally a millisecond blast. It's about, I think, 200 milliseconds per blast. So that's 200 milliseconds is 0.2 seconds, right? It's 0.2 of a second. In the racing world, it's a lot of time. However, in the rest of the world, it's not a lot of time. All right. So the laser breaks up the tissue, the herniation, into smaller pieces, and it frees it up. It releases it from the disc where it's stuck, so I can get it out. There's another piece of herniation there that just came out. Where do you normally work, doctor? Scott Gatzman.
He did 4 cases. Actually, 2 cases and 2 injections.
He's still around, huh?
Yeah.
That's impressive. In Orlando or where?
In Altamont Springs.
Altamont Springs.
First case was 3 levels.
Yeah. So you do propofol sedation for him?
No, general anesthesia. He
Oh.
doesn't do laser. That means
Huh?
he doesn't do laser. He does
Grabbing, fusion,
ACDF
like we did earlier.
or disc replacement.
He used to do lumbar endoscopic surgery a long time ago. I don't know if he still does it. He doesn't do the same as me, but it's similar.
You were surgeon or orthopedic?
He's ortho.
Yeah, I
Yeah, he's ortho. He's an interesting guy. Well, we're glad you're here to help us. This is granulation tissue, that little pink stuff right there. This is the tear, and you can see it's a bit scarred. And what you're seeing, by the way, is the laser is basically breaking the tissue up, the bad tissue up, into tiny little pieces that are then disappearing basically in front of your eyes. And what they're really doing is they're filling the water column, this area, this space around the laser, they're filling it with tiny little pieces, and you just can't see them. It looks hazy because of all those little pieces. Maybe you see them streaming up past us. But that is the debridement. You're basically removing small fragments of herniation and annular material and inflammation. You're getting rid of it in the debridement process. That's what we're seeing. So you won't see necessarily big chunks. You'll see tiny little stuff. There's some more of the tear right there. You see the pink? That's all inflammatory tissue. That's basically it here. This is the last of the tear.
We have a question when you're ready, doctor.
Sure, sure.
Yeah, this is for the anesthesiologist. Does the anesthesiologist ever use ketamine, as it is recommended for people who have pain diseases and disabilities? Thank you.
Oh, this question is for you, doctor. Do you ever use ketamine for people with pain diseases? Ketamine is rarely used, he says. He rarely uses ketamine. But ketamine has been shown recently to have effects on mood, right? And it's actually coming back and becoming favorable to help people who have some, I guess, mood disturbance. Is that it? It makes people feel good, right? Dissociative anesthesia? Yeah, some bad dreams. Yeah, we don't use a lot of ketamine, but if somebody is having, I guess it's appropriate once in a while, we use it. Our anesthesiologist uses it, but it usually wears off pretty quick, right? You like Versed? Of what?
I used a couple of cc's of ketamine with this patient.
Yeah, good. Yeah. In combination with Versed. All right, well, there it is. We're pretty much done with this disc. Just clean up a little bit of this stuff. Okay. It's looking good. That's where the tear was. And I'm very happy with the results. So this should heal nicely for him. Laser off. Turn off the irrigation.
Lights on, please.
We'll suck away the irrigation. And we're done with this one. A little antiseptic. I need that. I don't need the needle. I don't think so. Just betadine. Betadine, antiseptic. You know, we used to use irrigation with bacitracin, but now we just use some betadine because nobody likes to use the Basi. A little depomedrol just to reduce any inflammation that we cause around the nerve root. Pressure. And done. All right, So while you're holding pressure there on the paraspinous muscles for a few minutes, let me show the audience. We did the whole surgery through this little tube, endoscopically. So here's the endoscope. Wait, why is the endoscopic light on? You guys got to get this right. You're going to burn this out. Oh.
Nope. Nope. Right there.
All right, so the endoscope goes down the tube, and that's how we do the surgery, okay?
Does it get immediate relief?
Immediate. The pain he's had for 14 years will be gone. And it's not the steroid. The steroid doesn't start working for 2 days, a minimum of 2 days, sometimes up to 2 weeks. Yeah, I want to come to your side. The relief is because I debrided the annular tear. And nobody else does that. Everyone focused on the herniation. Herniation is not what's causing the pain. It's inflammation in the annulus, in the annular tear. All right, so we did the one disc up here. You can see the incision. And now we're going to do the other 2 discs that were 10 out of 10 pain. We'll start with L45 and then we'll do L34 next. Shot. I need to see my shot up there. Come on. Thank you. Whoever did that, good job. And the other one should learn. All right, shot. So this should be the bottom disc. Shot. Again, I'm looking for the guide wire, and I believe the guide wire is there. Shot. Uh-huh. And now we're going to come and take out shot. There it is. We're going to take out the needle. Shot. You got to be careful. Sometimes the needle will grab the guide wire and start pulling it. You don't want to lose your guide wire. If the guide wire comes out, you got to start over again. Okay? Don't just try to put it back blindly. You need the patient awake. Shot. Shot. All right, we're down on the herniation. Watch your laser. So we got to bring the dilator down into the disc through the tear. Shot. Good. Making some progress. You want to use the lateral view to do this. Shot. I can actually feel it passing through the tear. Shot. Take. It's trapping the guide wire and dragging it with it. So I don't want that to go any further. So I took the guide wire out because I'm inside the disc now. It's fine. Shot. And always you got to be checking on fluoro. You don't want to advance your dilator. Huh, see that popped in? There's a lot of pressure in this disc. Oh, I can feel it. It's pushing my dilator out, shot. Yeah, but we're inside, we're good. So, an inflamed disc, a herniated disc that has a lot of inflammation and pain is going to be swollen many times, especially in a younger patient. So this patient's disc is swollen and under pressure from the inflammation, just like a zit is under pressure, the center of the zit, and it can pop and squeeze everything out or shoot out. Scope on, good. All right, so we're down inside the disc once again. Grab her. It's a lot of degenerated nucleus here. Great questions from our audience so far. Are there any more I can answer? Take it.
Not as of now.
All right. So we're saving this patient from a brutal surgery called a fusion. A fusion would probably work as long as it's done right, but why have your back filleted open like a butchered cow and have screws and rods screwed into your spine and your discs taken out when they don't need to be taken out and fused with plastic and metal? All of that's completely unnecessary when all you need is the Duke laser disc repair, the procedure we're doing right now, endoscopic repair of the disc. This surgery has been peer-reviewed and published multiple times, about 6 or 7 different meetings, and in the National Library of Medicine and Surgical Neurology International. So you have a surgery that's safe and effective. It's all done through a tube that's 7 millimeters wide. Why would you want to have open back surgery? You shouldn't. Laser off. This gets rid of the pain, even in ways that open back surgery cannot. Okay? Most spinal surgeries don't get rid of pain the way this surgery does. That's why we've switched, basically. We barely ever do fusions anymore. We used to do fusions every week here for years, until the results of the endoscopic laser surgery we were doing, the Duke laser disc repair, became so much obviously better than fusion. It's just hard to justify doing fusion anymore unless there's a condition that we can't treat with the laser. Take it. Yeah. All that's herniated disc right there. Herniated interposed nucleus pulposus. The laser fiber is the blue wire. It's covered in plastic. It's blue plastic, and then there's a little glass part of the wire that comes out, and it's not made out of copper or metal. It's glass wire, and the glass wire transmits the laser's energy from the laser machine, which is by the patient's foot, right on over to the tip of this laser fiber, which is inside the disc, doing the debridement. Off laser. This is all annular tear here, full of interposed nucleus that's staining blue with our stain. Normally the annulus is white. It doesn't stain blue. Only when it has herniated nucleus material from the center of the disc squeezed into it does it actually stain blue. And that's what you're seeing. So that herniated nuclear material is what's causing all the inflammation and pain that this patient is suffering with. If we can get rid of it and we can get rid of their pain. So he has some really nice discs still. The discs are well preserved. They just have tears that are causing pain, but he doesn't have really much collapse of his discs at all. There's very little degeneration of his disc. We're just dealing with a tear and herniation. Just about done with this one. I'm lateral right now in the tear, in the lateral part of the disc. It's kind of almost extraforaminal, still intraforaminal, but right at the lateral edge of the foramen. So you can get far lateral herniations with this technique. You just have to know how to do that. Any kind of intraforaminal or in a lateral recess. If you really want to get a central herniation too, you can do that, but you have to start more lateral in the patient's body and aim more towards the midline. That wasn't our goal for this patient, because that wasn't his problem. All of this surgery is being done outpatient. There's no hospital stay. This patient's going to go home in an hour. In his case, he's staying at a hotel because he's from out of town. So he won't go home to Canada in an hour, but he'll leave for Canada tomorrow evening or the next day. That's how quick the recovery is. You can fly back to your home the next day. All right. I think that's it. Maybe a little bit more here. At 12 o'clock you can see blood vessels and nerve root. And you can see how inflamed the nerve root was. Look at that red color. That's fat. I can zap a little bit of the fat, but underneath the fat earlier, if you rewind, you'll see there was a red nerve root. And the red is inflammation on the nerve root. Why would the nerve root be inflamed? Well, because the disc is inflamed. It's this disc herniation that's caused all the inflammation. Yeah. Does that make sense? Because the disc is torn and inflamed, that inflammation is spreading onto the nerve root, which is right next to it. We're just irrigating with antibiotic. Irrigation. That is actually Bassi. I'm sorry, not Bassi, betadine, which is what NASA developed. NASA, by the way, is just around the corner from where we are. Literally 15 minutes from here. And let's put a little pressure here. Go ahead. So that was the L45 disc. We've got one more to do. It's L34. I'm excited for the patient. You can see how irritated the nerve root was, that red coloration, because his disc has been inflamed from the tear and the herniation in the disc. That inflammation spread on to the adjacent nerve root, and now we're going to got rid of the source of inflammation. Put pressure here. And we actually added a little anti-inflammatory medicine too that will probably kick in a couple of days. Shot. Want to make sure our guide wire stays where it is. Shot. That looks good. So once again, this is the You can see down below at the bottom is the sacrum or tailbone. And then right above that is the L5, then the L4, then the L3. So we are at the L3-4 disc now. That's what we're going to be working on next, all right? And of course, this would normally be painful, this part of the surgery, which is why our patient is asleep. We don't want him to suffer. And at this point, it's safe to put him to sleep. Shot. 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 Let me see. Let's do a little more just to be sure. Shot. Shot. Hold on. Shot. Yeah, that's better. Shot. And again, the pressure is just pushing this out because the disc is so swollen from inflammation. Again, a testament to the cause of this disease is inflammation as the source of the pain, both the back pain and the leg symptoms, by irritating the nerve root. His leg symptoms are minimal, but his inflammation is pretty severe. Everybody responds differently. Shot. 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 Yeah, don't bother bringing that unless it's a collapsed disc, okay? You're not going to need it. Let's get the fluoro out. So that's 5-1, 4-5, 3-4. We are at L3-4. Come on, Jordan. There you go. It's on my side. Yeah.
Alright, stand by, scope. Please. Lights off, please.
Any questions about the surgery from our audience?
Just one question about, do you accept insurance?
Do we accept insurance? Of course we do. Yeah, we accept insurance. For sure. Some insurances pay, some pay less, some pay more. Everybody's insurance is different. So we would need to know what insurance and what your plan says and what they cover. But a lot of times these days you don't know what insurance will pay for until after you have it done. Unfortunately, even if you have a contract with them, the insurance companies love to not pay. Because the more they don't pay, the more money they keep, right? For themselves. Have you noticed the insurance companies are making record profits the last few years? The record profits they're making doesn't come from premium increases, even though the premiums are going up. Their record profits come from denying to pay doctors, hospitals, nursing homes, therapists. Everybody in the medical profession has felt it. Even when they have a contract and they have to pay, they still don't pay at times. So everybody's insurance is different, and we just have to do it on a case-by-case basis to see what the patient's responsibility will be versus what the insurance will pay. Some insurances do better than others. We have an entire billing office with billing experts who are experts on insurance. Sometimes we even have to get our lawyers to go after the insurance companies to make them pay. And they do a good job, by the way. We recently had Blue Cross Blue Shield pay, United Healthcare, Cigna. The only one that we haven't gotten to pay is Medicare. We've even had TRICARE pay. So, as a matter of fact, we went to court with TRICARE over 10 cases and that they didn't want to pay, even though they authorized the surgery, told us they would pay. They put it in writing that they would authorize it and pay. After the surgeries were done and they got the bill, they decided they'd try to get out of it. Because it's not so much the military that is trying to get out of paying, it's the Humana who runs the TRICARE program. So Humana was trying to get out of paying, and we took them to court and we won. The judge ruled that they had to pay for the Duke laser disc repair. And we were paid. And even today we have TRICARE patients that come, get the surgery done, we bill the TRICARE, and TRICARE pays most of the time. They deny it sometimes, and then we fight them. You win some, you lose some. Depends on who you get from the insurance company, who's reasonable, and how reasonable they're going to be. But I can tell you this, every insurance company always tries to get out of paying. Now, we've had some really good luck with Christian Care Ministries, I believe. And they will pre-authorize and agree to pay. We give them a discount. And they're happy about that, of course. All right. About half the insurances don't give us a problem. About half of them give us a problem. You never know which one's going to do what until you bill them for the surgery. There's the tear. Clear as day. And look how nice this responds to the laser. It's surprising because he has 14 years of back pain. And what I'm seeing in this disc is, this doesn't look that old. So I wonder if his original back pain was the L12, and then over time the 3, 4, and 4, 5 became more painful for him, like newer herniations, more recent. That's certainly a possibility. It's kind of interesting trying to piece together everyone's individual story, and what you see in the disc when you get in there. Do you have another question?
No, that's all.
When we did the discograms earlier, you could see the patient responded. His back tensed up when I injected the dye on those discs. So they confirmed that these 3 discs were indeed the cause of his pain. I believe they're the only cause of the pain, so hopefully when we're done, he's going to have great relief of his pain. We got about 5 minutes, doctor. If you want to start waking them up, you're welcome to. We're going to probably just put a Band-Aid, some steri strips, and a Band-Aid. Huh? Oh, okay, that's fine. Yep, thank you. Are you working with Dr. Patel tomorrow?
It's gonna be with us.
Yeah. Where did you do your training? Miami? Miami?
That's Memorial Hospital.
Yeah, it's a good hospital. Did you subspecialize or just general anesthesia? Where do you live?
The Ryder Trauma Center is a nightmare.
Trauma center, tell me about it. Why do you think I don't work at a trauma center anymore? I had many years at a trauma center. Yeah, it's good practice, good training, good learning. But I don't enjoy it any more than you.
You're right. Give you good training.
Very good training, yeah. You do your time.
People get shot so you can learn.
Right? Listen, I went to County Hospital, LA, Los Angeles. That's where I did my med school training. You think Miami is bad? It's not as bad as Los Angeles County. I used to live in the dorm, nurse's dorm, right in the hospital, next door. All night long you heard gunfire. All night, every night. Brrr, brrr, boom, boom. All night long throughout the window. This is Southeast LA, you know? All the gangs are. Non-stop gunshots. It's incredible. I heard about it, I didn't believe it until I went and I saw it. This is the tear, by the way. That's the herniation. The blue stuff is the herniation stuck in the tear. If you watch our video, you'll see that. Zach made a beautiful video. And the white is the annulus that's torn. The blue stuff is the nucleus that's stuck in the annular tear, causing all the inflammation.
Doctor, we have a question.
Sure.
Our
Stand by.
patient is having an ablation soon. She's asking if it works.
Yeah. So somebody's having ablation soon. They want to know if it works. It does work most of the time. Ablation does. As long as you did the medial branch block and you got good relief on the medial branch block, the ablation should work for you. So I would be very optimistic about it. So typically we do ablation if the patient gets how much relief? 60% improvement or more. 60. It used to be 50, now it's 60. So if you've gotten 60% improvement temporarily with that diagnostic block, then I think it's worth doing. The ablation is a non-surgical treatment. It's wonderful. If it works, you can avoid surgery. Some people are lucky their back pain doesn't come from a herniated disc. It comes from the facet joints. And if that's the case, then treating the facet joint will work. My back is starting to hurt me. Huh? Well, I don't have like a disc problem. I'm just tired. My back is tired. My muscles are tired. My lead is about to fall off. Can you grab it for me? Oh, I'm going to drop it right now. Hold on. I've gotten skinnier. I tell you, surgery is wonderful. It's a great way to lose weight. Right? Luis is like, yes, I'm hungry. Have you eaten anything? Go eat something. Take 5 minutes. Go eat.
I don't feel hungry until I finish my job, so I just honestly.
Really?
Yeah. That's me. I try myself to
All right. Oh. Luis has managed to lose quite a bit of weight since I first met him. Huh, Luis? Now he's looking like one of those, you know, centerfolds in Playgirl magazine. You're too funny. Right? Just to meet Luis. We could do a calendar someday. The Duke Spine Calendar. Right? Check out my laser. Here. All right, we're done.
Stand by, light, please. No, I don't think so.
Oops. I don't need. Just do this.
You want to switch your turn?
I don't.
I don't think so. I don't think so.
Let me look and see. You have the dilator? I just squirted myself good with the. Uh-huh. You gotta make it. Yeah. That's good. Yeah.
Yes.
What is this? Local? Oh, where's the irrigation? Let me do one more irrigation. Uh-huh. I'm going to show you just a minute here what the incision looks like. Just want to irrigate one more time. Dilator. No. Telling the people that I just want to try one more
You can turn
irrigation.
on the please, thank you. Thank you. All right, buddy, you can start disconnecting. Remember the paper. Very, very
All right, so we did both discs through this tiny little cut here. Okay, and the tube. Show them the tube. Yep, it's like a McDonald's shake straw. Go ahead, put the pressure. So we did one incision on the right and we did a tiny incision on the left. They look like puncture marks. They actually disappear after a few months. People come back, they say, I can't even see my incision. It's completely gone. Good work, everyone. Thank you. Yeah, it's just iodine. Go ahead and type your questions up for me and I'll come and answer them.
Morning, I was up and about and out, dressed on the job.
I have no pain. I'm living my life and doing great things, and I'm just very happy.
It's a great feeling not to be in pain.
Duke Spine Institute has changed thousands of lives. Isn't it time you live your life pain-free? Log in to dukespine.com or call 1-800-FIX-MY-BACK for a free MRI review and consultation.
I feel like a new man again.
And it's thanks to Dr. Duke. He gave me my life back.
Dr. Duke did an amazing job fixing my back. I recommend him highly to anybody who has any kind of back issues, any kind of back pain. Don't wait. Go see him. The relief is amazing.
The pain level got to about an 8, a 9.
The right side of my body from the waist down was pretty much useless and in pain constantly.
The pain was chronic.
It was an aching, stabbing.
It became unbearable. It became where I didn't want to get out of bed. I didn't want to talk to anybody. I didn't want to do anything.
I had the pain every single day in my low back.
It's torturous. I can't go to sleep at night. I can't lay down. I can't sit for too long. Can't stand for too long.
I couldn't sit. I couldn't stand. I couldn't walk more than 50 feet.
It's excruciating.
Sends excruciating pain across my back. Gets down to my hands where my hands are numb.
I had no life.
If you are suffering from neck or back pain, the Duke Spine Institute can give you the relief you need to live your life without pain.
Now I have absolutely no pain.
Not even 24 hours after the surgery was complete, I was able to be how I felt is normal. And it was good.
No scars, didn't hurt at all. When I woke up, it was totally painless.
The next morning, I was up and about and out, dressed on the job.
I have no pain. I'm living my life and doing great things, and I'm just very happy.
It's a great feeling not to be in pain.
Duke Spine Institute has changed thousands of lives. Isn't it time you live your life pain-free? Log in to dukespine.com or call 1-800-FIX-MY-BACK for a free MRI review and consultation.
I feel like a new man again.
And it's thanks to Dr. Duke. He gave me my life back.
Dr. Duke did an amazing job fixing my back. I recommend him highly to anybody who has any kind of back issues, any kind of back pain. Don't wait. Go see him. The relief is amazing.
The pain level got to about an 8, a 9.
The right side of my body from the waist down was pretty much useless and in pain constantly.
The pain was chronic.
It was an aching, stabbing.
It became unbearable. It became where I didn't want to get out of bed. I didn't want to talk to anybody. I didn't want to do anything.
I had the pain every single day in my low back.
It's torturous. I can't go to sleep at night. I can't lay down. I can't sit for too long. Can't stand for too long.
I couldn't sit. I couldn't stand. I couldn't walk more than 50 feet.
It's excruciating.
Sends excruciating pain across my back. Gets down to my hands where my hands are numb.
I had no life.
If you are suffering from neck or back pain, the Duke Spine Institute can give you the relief you need to live your life without pain.
Now I have absolutely no pain.
Not even 24 hours after the surgery was complete, I was able to be how I felt is normal. And it was good.
No scars, didn't hurt at all. When I woke up, it was totally painless.
The next morning, I was up and about and out, dressed on the job.
I have no pain. I'm living my life and doing great things, and I'm just very happy.
It's a great feeling not to be in pain.
Duke Spine Institute has changed thousands of lives. Isn't it time you live your life pain-free? Log in to dukespine.com or call 1-800-FIX-MY-BACK for a free MRI review and consultation.
I feel like a new man again.
And it's thanks to Dr. Duke. He gave me my life back.
Dr. Duke did an amazing job fixing my back. I recommend him highly to anybody who has any kind of back issues, any kind of back pain. Don't wait. Go see him. The relief is amazing.
The pain level got to about an 8, a 9.
The right side of my body from the waist down was pretty much useless and in pain constantly.
The pain was chronic.
It was an aching, stabbing.
It became unbearable. It became where I didn't want to get out of bed. I didn't want to talk to anybody. I didn't want to do anything.
I had the pain every single day in my low back.
It's torturous. I can't go to sleep at night. I can't lay down. I can't sit for too long. Can't stand for too long.
I couldn't sit. I couldn't stand. I couldn't walk more than 50 feet.
It's excruciating.
Sends excruciating pain across my back, gets down to my hands where my hands are numb.
I had no life.
If you are suffering from neck or back pain, the Duke Spine Institute can give you the relief you need to live your life without pain.
Now I have absolutely no pain.
Not even 24 hours after the surgery was complete, I was able to be how I felt is normal. And it was good.
No scars, didn't hurt at all. As you know, when I woke up, it was totally painless.
The next morning, I was up and about and out, dressed on the job.
I have no pain. I'm living my life and doing great things, and I'm just very happy.
It's a great feeling not to be in pain.
Duke Spine Institute has changed thousands of lives. Isn't it time you live your life pain-free? Log in to dukespine.com or call 1-800-FIX-MY-BACK for a free MRI review and consultation.
I feel like a new man again.
And it's thanks to Dr. Duke. He gave me my life back.
Dr. Duke did an amazing job fixing my back. I recommend him highly to anybody who has any kind of back issues, any kind of back pain. Don't wait. Go see him. The relief is amazing.
The pain level got to about an 8, a 9.
The right side of my body from the waist down was pretty much useless and in pain constantly.
The pain was chronic.
The pain level got to about an 8, a 9.
The right side of my body from the waist down was pretty much useless and in pain constantly.
The pain was chronic.
It was an aching, stabbing.
It became unbearable. It became where I didn't want to get out of bed. I didn't want to talk to anybody. I didn't want to do anything.
I had the pain every single day in my low back.
It's torturous. I can't go to sleep at night. I can't lay down. I can't sit for too long. Can't stand for too long.
I couldn't sit. I couldn't stand. I couldn't walk more than 50 feet.
It's excruciating.
Sends excruciating pain across my back, gets down to my hands where my hands are numb.
I had no life.
If you are suffering from neck or back pain, the Duke Spine Institute can give you the relief you need to live your life without pain.
Now I have absolutely no pain.
Not even 24 hours after the surgery was complete, I was able to be how I felt is normal. And it was good.
No scars, didn't hurt at all. When I woke up, it was totally painless.
The next morning, I was up and about and out, dressed on the job.
I have no pain. I'm living my life and doing great things, and I'm just very happy.
It's a great feeling not to be in pain.
Duke Spine Institute has changed thousands of lives. Isn't it time you live your life pain-free? Log in to dukespine.com or call 1-800-FIX-MY-BACK for a free MRI review and consultation.
I feel like a new man again.
And it's thanks to Dr. Duke. He gave me my life back.
Dr. Duke did an amazing job fixing my back. I recommend him highly to anybody who has any kind of back issues, any kind of back pain. Don't wait. Go see him. The relief is amazing.
The pain level got to about an 8, a 9.
The right side of my body from the waist down was pretty much useless and in pain constantly.
The pain was chronic.
It was an aching, stabbing.
It became unbearable. It became where I didn't want to get out of bed. I didn't want to talk to anybody. I didn't want to do anything.
I had the pain every single day in my low back.
It's torturous. I can't go to sleep at night. I can't lay down. I can't sit for too long. Can't stand for too long.
I couldn't sit. I couldn't stand. I couldn't walk more than 50 feet.
It's excruciating.
Sends excruciating pain across my back, gets down to my hands where my hands are numb.
I had no life.
If you are suffering from neck or back pain, the Duke Spine Institute can give you the relief you need to live your life without pain.
Now I have absolutely no pain.
Not even 24 hours after the surgery was complete, I was able to be how I felt is normal. And it was good.
No scars, didn't hurt at all. When I woke up, it was totally painless.
The next morning, I was up and about and out, dressed on the job.
I have no pain. I'm living my life and doing great things, and I'm just very happy.
It's a great feeling not to be in pain.
Duke Spine Institute has changed thousands of lives. Isn't it time you live your life pain-free? Log in to dukespine.com or call 1-800-FIX-MY-BACK for a free MRI review and consultation.
I feel like a new man again.
And it's thanks to Dr. Duke. He gave me my life back.
Dr. Duke did an amazing job fixing my back. I recommend him highly to anybody who has any kind of back issues, any kind of back pain. Don't wait. Go see him. The relief is amazing.
The pain level got to about an 8, a 9.
The right side of my body from the waist down was pretty much useless and in pain constantly.
The pain was chronic.
It was an aching, stabbing.
It became unbearable. It became where I didn't want to get out of bed. I didn't want to talk to anybody. I didn't want to do anything.
I had the pain every single day in my low back.
It's torturous. I can't go to sleep at night. I can't lay down. I can't sit for too long. Can't stand for too long.
I couldn't sit. I couldn't stand. I couldn't walk more than 50 feet.
It's excruciating.
Sends excruciating pain across my back, gets down to my hands where my hands are numb.
I had no life.
If you are suffering from neck or back pain, the Duke Spine Institute can give you the relief you need to live your life without pain.
Now I have absolutely no pain.
Not even 24 hours after the surgery was complete, I was able to be how I felt is normal. And it was good.
No scars, didn't hurt at all. When I woke up, it was totally painless.
The next morning, I was up and about and out, dressed on the job.
I have no pain. I'm living my life and doing great things, and I'm just very happy.
It's a great feeling not to be in pain.
Duke Spine Institute has changed thousands of lives. Isn't it time you live your life pain-free? Log in to dukespine.com or call 1-800-FIX-MY-BACK for a free MRI review and consultation.
I feel like a new man again.
And it's thanks to Dr. Duke. He gave me my life back.
Dr. Duke did an amazing job fixing my back. I recommend him highly to anybody who has any kind of back issues, any kind of back pain. Don't wait. Go see him. The relief is amazing.
The pain level got to about an 8, a 9.
The right side of my body from the waist down was pretty much useless and in pain constantly.
The pain was chronic.
It was an aching, stabbing.
It became unbearable. It became where I didn't want to get out of bed. I didn't want to talk to anybody. I didn't want to do anything.
I had the pain every single day in my low back.
It's torturous. I can't go to sleep at night. I can't lay down. I can't sit for too long. Can't stand for too long.
I couldn't sit. I couldn't stand. I couldn't walk more than 50 feet.
It's excruciating.
Sends excruciating pain across my back. Gets down to my hands where my hands are numb.
I had no life.
If you are suffering from neck or back pain, the Duke Spine Institute can give you the relief you need to live your life without pain.
Now I have absolutely no pain.
Not even 24 hours after the surgery was complete, I was able to be how I felt is normal. And it was good.
No scars, didn't hurt at all. You know, when I woke up, it was totally painless.
The next morning, I was up and about and out, dressed on the job.
I have no pain. I'm living my life and doing great things, and I'm just very happy.
It's a great feeling not to be in pain.
Duke Spine Institute has changed thousands of lives. Isn't it time you live your life pain-free? Log in to dukespine.com or call 1-800-FIX-MY-BACK for a free MRI review and consultation.
I feel like a new man again.
And it's thanks to Dr. Duke. He gave me my life back.
Dr. Duke did an amazing job fixing my back. I recommend him highly to anybody who has any kind of back issues, any kind of back pain. Don't wait. Go see him. The relief is amazing.
The pain level got to about an 8, a 9.
The right side of my body from the waist down was pretty much useless and in pain constantly.
The pain was chronic.
It was an aching, stabbing.
It became unbearable. It became where I didn't want to get out of bed. I didn't want to talk to anybody. I didn't want to do anything.
I had the pain every single day in my low back.
It's torturous. I can't go to sleep at night. I can't lay down. I can't sit for too long. Can't stand for too long.
I couldn't sit. I couldn't stand. I couldn't walk more than 50 feet.
It's excruciating.
Sends excruciating pain across my back. Gets down to my hands where my hands are numb.
I had no life.
If you are suffering from neck or back pain, the Duke Spine Institute can give you the relief you need to live your life without pain.
Now I have absolutely no pain.
Not even 24 hours after the surgery was complete, I was able to be how I felt is normal. And it was good.
No scars, didn't hurt at all. You know, when I woke up, it was totally painless.
The next morning, I was up and about and out, dressed on the job.
I have no pain. I'm living my life and doing great things, and I'm just very happy.
It's a great feeling not to be in pain.
Duke Spine Institute has changed thousands of lives. Isn't it time you live your life pain-free? Log in to dukespine.com or call 1-800-FIX-MY-BACK for a free MRI review and consultation.